Hi, Dr. Burris. We are live and we are ready for your brilliance today. It looks like Dr. Kim's on his way, or maybe he's not going to make it with us today, but just want you to know we are live and ready for you.
Great. Hi, Jeff. I don't know whether Dr. Kim's going to make it or not. I suspect not today. Um, we are in the midst of the COVID surge, luckily not overwhelmed or anything, but it has gotten a tad bit busier in the last week or so.
Mm.
So today is the 18th of August, and I thought that I would give you the updates that I have and talk a little bit about the new recommendations that are coming out about boosters, what it means, what does it mean if you got a Johnson and Johnson rather than a Pfizer or a Moderna, and sort of what does that mean about how good the vaccines are, and sort of big picture it for you, and plus give you the details that I have. So to start with, I thought that I'd give you what I could find on our local and state data. So we can look at that first slide. The county has gone to only giving once a week updates on the um, most of the data, and they've gone to not putting it out until the end of the day on Wednesdays. So we don't have that. But if we go down on this web page a little bit, we can get a pretty much a snapshot view of where we are today as far as our case rates and our positivity rates on our tests, as well as the hospitalizations. And what we see here is the continuing upward trend. If we were still in our tiers, we would be back in purple tier. I think that's good to sort of step back and think about a bit, because we still have not reinstated any of the restrictions that we had previously during purple tiers, like a mask mandate indoors or a limit on capacity. So currently we're back at that same high level of transmission and that same increasing number of hospitalizations and deaths without going back to any of the mitigation efforts other than vaccination. So I just kind of want to sort of set the stage a little bit, and I have my theories on why they've taken this particular stance right now, but there are some concerns I have about whether we'll turn around or limit this surge as much as we might have been able to if we had gone back to some of our previous mitigation efforts. But this is where we are now. Our positivity rate for the county is at 12.5%. Our hospitalizations are continuing to increase. We now have around 530 people in the hospital with COVID in the county, and 106, I believe, in the ICU. These, again, are not overwhelming numbers. The hospitals are still functioning well, unlike in some of the other areas of the United States. We are not out of ICU beds. We are not in danger of running out of ICU beds, but we are in danger of overwhelming the capacity of the staffing of the hospitals. And so it's something we want to keep in mind, that everywhere is trying to get nurses right now. You can't just go hire another 10 nurses. That's just not possible right now. So we do have some limits in our ability to flex and increase capacity versus where we were at the beginning of the pandemic. So that's where we are. Our case rate is 32.9 per 100,000. Just to give you some comparison to where we are compared to the rest of the United States, I mean, we're seeing an increase definitely in California, but the case rate in Florida right now is somewhere over 600 per 100,000. So we're at 32, they're over 600. It gives you an idea of how different the outbreak is, or the transmission rates are right now in different areas of the country. Okay, so let's go to the next slide. And this is our vaccine update for the county. So this gives us sort of an overview of how we're doing as a county at getting our population vaccinated. And you'll see that our fully vaccinated is still hovering around 50%. I mean, we're still vaccinating, and that number is still slowly increasing, but it really isn't jumping up like I wish it was. I mean, technically, we could have been at 85% fully vaccinated if we had been able to run at capacity. And if we didn't have some of the challenges that we've had as far as encouraging people to get vaccinated, or allaying some of the fears. So you'll see we're kind of floundering now in this 60 partially vaccinated, 50 fully vaccinated, and we've been here for like a month. So I look at these data and I'm like, yeah, we're better than some places, but we should not get complacent and think we're not going to get hit by Delta. We still have 40% of our population over 12 completely vulnerable, and 100% or so of our population under 12 is completely vulnerable. So we're still, we're still vulnerable, and we shouldn't think that we're not going to see a continued increase in our cases. Okay, so next slide. Let's go on down a bit. I looked as far as I could find, and this is the update for today from the California's COVID webpage. And this just shows you a sort of like a bigger view of California and where we are. And, we're having no problems doing testing, except we have a huge back order on rapid tests. So right now, I don't know if people went out and bought a whole bunch of the home-based tests. I know a few people who kind of bought them in large supply because they thought they may need them for workplace testing or school-based testing. And so a lot of individuals I know have sort of stockpiled rapid tests. And so now it's actually hard for health systems and clinics to get rapid tests. So we may have a short, I would say, maybe month difficulty, and we may see some shortages in our rapid tests, but our capacity to run PCRs is totally fine. So we'll still be able to run all of the PCR tests. Currently, our clinic is doing rapid testing still, and I know there are other places who are still doing it. It's just we're noticing a little bit of a lag in the supply chain right now, and so that's something that we may see impact us on a nationwide level a little more. Deaths in California, 90 today. Those have been creeping up back up toward the 100 level. And then our cases today took a bit of a jump. We see this 14,000 cases in California reported today. So that's continuing to creep up. I mean, prior to Delta hitting us, we were averaging somewhere in the 2,000 to 3,000 range. So we've seen this steadily increase as well. Let's go to the next slide. So today we got, some continued news that we're going to be having this recommendation for booster shots. And I wanted to show the next slide to talk a little bit about why this is done. And it's not being done because the vaccines don't work. So I want people to understand that the the vaccines are still performing against Delta exactly as we hoped they would. So before the Delta variant showed up, they were 95% effective at preventing hospitalization. So that meant when people were infected with COVID, they had a much lower chance of actually being hospitalized. Now, with Delta, that's gone down slightly, but really very slightly. So they're still 92% effective at preventing hospitalization, which we would put in the category of severe disease. This is great news. So the vaccines still are working, but what we're seeing is after about 6 to 8 months, we're seeing a drop in the level of circulating antibody, which is allowing more cases to develop in people who've been vaccinated. These tend to be mild cases that don't require hospitalization. Some of them are so mild that they're being missed. However, they're still occurring, and that allows transmission to occur. And we still have some people who did not develop good antibodies with their first round of vaccination. So we've had two things happen this week. So I'm done with the slides. The first thing that happened this week was that the CDC said that people who were significantly immunocompromised, so these are people on transplants, immunosuppression, people who are on high dose chemo, people who have other serious immune dysfunction, may not have mounted a really good immune response when they got the vaccine the first time. So they were encouraged to go ahead and get a third shot, not because it's a booster shot, but because we think they need additional vaccine in that first series to actually get them to the immune status that they needed to be protected. So the first group of people who were saying go back and get a third shot, that's that group that is immunocompromised, and that's because we don't think it was good enough just to give them two. We think they need three altogether. And from now on, when an immunocompromised person is getting vaccinated, they may have a series of shots at, say, day 1 month later, and 6 months later. We do this with some of our other vaccines, and this is considered an initial series. So after those 3 shots, they would be considered immune. However, for the rest of us, those of us who had healthy immune systems and got our series of shots, those first 2 shots did fine. We had really good immunity. And so now what they're looking at is after about 6 to 8 months, the circulating antibodies are dropping and people are getting these mild cases. And so we think that that 8-month period is about the time when, if we give a booster shot, it'll bring up that circulating level of antibody enough to prevent as many of those breakthrough cases. It appears to still be very effective against severe disease. So if you had a really hard time with that first 2 rounds, I think that third shot, you could still keep it in your optional category because you're still very well protected against severe disease. But if you are, say, like me, in a job where I'm coming into contact a lot with COVID, and I have a young child at home who cannot be immunized, a booster shot for me makes a lot of sense because I got immunized about 9 months ago. And so I'm in that group that may have some waning immunity. So currently, the advice is we're going to see them offer third doses to everyone about 8 months after your initial series. And so, depending on when you were vaccinated, you can count forward. This supposedly is starting at the end of September. I suspect people will start getting boosted before then because if they have a way to do it, they may. But September 20th is the date that they've set to begin doing the booster shots. The question is, if you got Pfizer the first time or Moderna the first time, should you get a different vaccine? Currently, I've not heard any guidelines to definitely get the same one or definitely get the different one, or whether or not that matters. I suspect the guidance will come out to get the same vaccine that you got the first time, with a caveat at the bottom that if it's not available, go ahead and get the other one, which kind of means we don't know. We don't think it'll hurt, but we don't have data, so we can't advise you officially. That's how I feel this guidance is going to come out. If it were me, honestly, I wouldn't be nervous to get either one. We do not have guidance yet about what to do if you receive the Johnson & Johnson vaccine. I think the silence is because they're actually actively collecting the data from the ongoing study on J&J. Remember, that vaccine was actually approved later, and so is a little bit later in their data production that they're giving to the FDA on more long-term antibody titer data. So the Johnson & Johnson will probably get some recommendation on what to do if you've had a J&J vaccine, probably coming out in the next month. But that one's going to require a little bit of patience. Some people are going ahead and getting the mRNA vaccines if they previously had the Johnson & Johnson. We don't have any anecdotal evidence to say that's a bad idea. We have anecdotal evidence to say that's a good idea, but we don't have firm guidelines yet on that. So I just want to let people know it's a little bit of a free-for-all on some of the, when you get into the weeds on some of these like specific situations. So that's where we are as far as what official guidance is, what we think, and what is going to be available as far as boosters. Overall, I think if you've been vaccinated about 6-7 months ago, you're fine to just sit back and wait another month or two and see what sort of comes of this. I don't think anybody needs to be rushing to go get your booster before we get that official information, with the exception of the people who are highly immunocompromised, and then that third dose is available now, and it's not considered a booster, it's considered part of the original series. You definitely should go out and get that third shot because Delta is a pain and you do not want it. So I way went over. I totally apologize. But that's about it. That's all I have today for you. And I'm Dr. Burris with Coachella Valley Direct Primary Care.